can share your screen now.
Okay, so it's really a great pleasure to be there. So I'm so grateful for Get to have invited me here to give this talk on the ethical, legal, and social challenge of genomic research and data sharing. And yes, it is my expertise, data sharing and data protection in genomics, but I also want, and of course, the ethical, legal, social issues that this raises. But however, I'm not an expert of genomic data sharing in Africa. And so I really hope I can also learn from you in an exchange today in this presentation about how some of what I will say, some of these issues that we're going to be talking about resonate with you in your own countries. So I'm really looking forward to the discussion after the talk as well. All right, let me get started on my slide. So I think that Professor Owolabi gave a fantastic oral on the benefit of genomic research, on what genomic research can bring to Africa. So I'm not going to talk too long about that. He did it much better than I would have done it. So I will simply say that viral and host genome sequencing is essential to track the viral origin, the spread, the evolution, and to characterize the role of genomic in pandemic outbreak. I was part of the Canadian team that basically sequence and share the genomic sequence of both the COVID virus and also the host, so the patient genomic sequence as well, to try and better understand how the virus function. And this was a fantastic experience. You can see on the little map that you're on the side some of the example of how we can track the spread of various strand of the virus. And so rich genomic information facilitate time-sensitive, critical public health decision across country and world region during a pandemic. In times of pandemic, everything moves fast. So you have to be able to move faster, and you have to be able to share data extremely quickly in real time to promote responsive research. And we're also moving towards One Health real-time genomic surveillance and monitoring of pandemic threats. So we really want to track the virus and its evolution across different species, across environmental species, across animal species, and across human species, so we can respond really quickly to these new pandemic threats. So really, when facing a global pandemic, there is a need to facilitate and optimize research to improve the public health response and broad access to genomic and health data, because we need to also we were talking about sequencing genomic, and now genomic is fantastic. It's such a rich type of health information, but it needs to be accompanied with what we call metadata, all the little information about the genomic sample and also the demographic data. So it's not just the genomic information, but it's all the information that accompany it that makes it so precious for research. Of course, and I want to end this first part by saying that global health is a human right, and it's also a global public good. And arguably, health information is also a global public good. And that's why we should share it. This is just, and I will not stop on all these declarations. It's just a quick timeline explaining the various declarations promoting the sharing of genomic data for research. The take-home points to consider is this is still a recent adventure. It really started in 1996 with the Bermuda Principles. Those principles were adopted at the time where we did the first human genome sequence. And that's when it was so apparent that instead of competing, we should be putting the data for everybody to see in real time in order to progress as quickly as possible. Of course, things are a little bit different when we're not talking about human genetic sample, but about environmental genomic resource, and etc. And we know that in that case, of course, countries and continents in the global south a very rich resource. And sadly, there has been cases where people from the Northwest have come and just taken that genomic information, not giving anything in exchange, not informing people of the result. And because of this, there have been some convention that have been developed so that these types of resources are protected a little bit more, so that we can just come and take those resources away and not give anything in exchange. Of course, organizations have been created also to facilitate that global data sharing. In the case of human genomics, it's the Global Alliance for Genomics and Health that is the most active organization. In the case of viral genome, it's the Public Health Alliance for Genomic Epidemiology, which is also called FCAHS. All right, now moving on. So why is genomic information, why do we talk about genomic information in a different way that we would talk about other types of health information? Why is it so important that we consider the ethical, legal, and social implication of this data? Well, so first of all, human genome data is uniquely identifying. As soon as I have a little bit of blood from you or a little sample, a little spit sample, I can actually uniquely identify you. It is unique to you, that sample. And then I can possibly use other database to create a link to your personal identity. So that is a precious resource for forensic investigation, but can also be used to discriminate. Also genetic information, and again, you don't need a lot of it. A very small quantity of genetic information can already be predictive of current and future health conditions that you may have. So it also tells me a lot about your health. And finally, we share genetic information in substantial part with close and distant relatives. So for example, your genetic information, you share it in vast amount with member of your family. So it also tells me things about member of your family. It can also tell me from which population group you are. So it's extremely informative, is the main reason why genetic information is different from an ethical and legal standpoint, and why sometimes we need to protect it more. However, we must also draw a line when we talk about viral sequence genomic data. A virus sequence does not have a right to privacy. So it's not considered personal data. It's not human genetic data, and doesn't really raise issue. So I do want to make it very clear that we talk about the human genome data now when we talk about ethical, legal, social issue. Viral sequence genomic data is different. It might raise some issue, but I would gather they're not as profound, because it doesn't come directly from the human source, and it cannot identify the human source if we have done our job well. So the first, and I'm not going to address all the ethical, social issues of genomic data, just a couple of those that I think are the most interesting, and perhaps the one you're more likely to meet in your continent. So the first point I want to make is the importance of including data of African population group in international research. It's so important because we need a diversity of data. If we don't have data from some population group, then the result of the genomic research will not apply to the population group whose data we're missing. We're not going to know if that works the same way. It might, but it might not. So in a way, if you're not included in the research, you also do not stand to gain the benefit from this research. One thing that we must be careful, however, is that individuals from low and middle income country can become even more vulnerable in time of public health emergency because, of course, the infrastructure might not be developed as well to fight off the pandemic threat. And then, we have to be very careful that we are not, again, coming to these countries, taking all the genetic material that we need for our research and let them face the pandemic on their own. So we have to be aware of that vulnerability, and we have to make sure that there are plans that will benefit the infrastructure if we actually go and do some research there, and how we can improve the capacity and how we can work with people on the ground. One of the key points I found in my own experience that researchers don't do enough and should do more of is we should have an early preparation strategy so that it's not the time when the pandemic starts to go and engage all these communities and talk to people about, oh, we'd love to have, genomic sample from your community. That should be done before. We should be prepared so that in time of pandemic, we can respond extremely quickly and be able to collect the data because all the agreements are already in place and we've already discussed about benefit sharing, etc. So again, if you're going to include population from low and middle income country, you have to be aware that these population have a right to participate in the governance of the data and the sample. So we call it responsive governance. It's basically responding to the patient and to the participant. So they have a voice in the governance framework. It must benefit capacity development on the ground. There must be equitable access to the sample and data. And sometimes equitable access doesn't mean equal access. Equitable means that some population might need to have even earlier access than other ones because they don't have the same capacity. And so they need this little advantage in order to be on equal footing with others. And we must think about sharing the benefit of the research as well. Extremely important, because there's been abuse in the past, some population from low and middle income countries have concerns, and they're right to have these concerns. And so we must think about what are these concerns. We must discuss with people again on the ground in order to address these concerns, because otherwise what happens is people are unwilling to participate because they're afraid for sometimes very good reason. So that is also key. And we also, once the data is collected, another problem is sometimes, because sometimes some small population group, we don't have a lot of genomic data in our database about them. So then it just stays there. Nobody uses it because people think, oh, it's not enough data to analyze it and make strong correlation. It still should be used. If you collect the data, everything should be used. Everything should be done to use it if it is possible. I mean, of course, if it is absolutely not usable because, for example, it is a very poor quality or there really is not enough for statistical analysis, okay, but the onus should be on the researcher to demonstrate that or otherwise to use the data. Finally, I urge people to be really careful about this. There is a lot of talk about ownership of data and sample. Personally, I'm not a fan of this concept of ownership. It is true that if you consider that you own the data and the sample, it might allow you as a population group or as a nation to say, this belongs to us. Therefore, you need to accept our condition to access it. But at the same time, ownership complicates everything in trade because it makes it more complicated for a researcher to access the data. So they're much less interested in doing research with you and might simply go elsewhere. Also, if you start talking about ownership, they might eventually start talking about ownership as well. And then it becomes kind of a war of knowing who owns the data, when I believe it's much more simple to talk about a global public good and talking about good data stewardship than ownership. But that is my belief, and I understand some people feel differently. Talking about consent now, Of course, you don't collect genomic data from individual without consent. Consent must be free and informed. Also, an ethics committee must approve the collection and use of genomic data for research. So we want to make sure basically that people are not cheated of their genomic data, that it's something that is not forced upon them, that they're not forced to give it, that they understand what is happening and why they're doing it. However, sometime when there's a public health emergency, of course, you also have to think about the collective good, not just about the individual. And so sometimes it's possible to waive some of these requirements, and you really have to look at the national law in your country and the ethics guideline. But sometimes you may waive these requirements in time of public health crisis. And again, if you're talking about viral sample, so basically samples from the virus, they have been collected on a patient, but they're not about the patient, they're about the virus. And they've been taken in the context of care. You were basically taking care of a COVID patient. Then it's unlikely that these requirements would apply. You would not need the free and informed consent of the patient for the collection and use because they've consented to care. And it was taken in the context of care for pandemic. And so in that case, but I'm again really specific that we're talking about the viral sample, not the patient genomic sample. Of course, if you take genomic data, you must protect it. That's extremely important. You must ensure a reasonable level of protection for the genomic information of patient and the other health data that accompanies it. Why do I say a reasonable level of protection? Because there is really nowadays a new profession that has emerged that is really all about, cracking data on the internet, about basically being able to, even though you're protecting the data, they have very sophisticated information technology strategies to be able to break through your protection and to see the data. So perfect protection, it's sad to say, is almost impossible. So what you need to do is protect it as much as you can with the most up-to-date technology. And what you can do, these are examples of how you protect the data that I put. So first of all, you de-identify your genomic information. What does that mean? It means that you're basically removing all personal identifier from the data. So for example, you're replacing the name of the patient by a number. Then, you are also removing all direct information that accompanies it, the age, the address of the person, etc. And you replace it, or you just completely remove it, or you replace it by more indirect identifier, making it more complicated to associate the genomic sample with the person. There is also information technology security tool to protect your information. So we talk, for example, about firewall, we talk about password, and we talk about encryption, coding your data to make it even more difficult to access the data, and you can sometimes add noise to the data so that even if people can actually see the genomic sequence, you've added things into it to make it more complicated to understand. You can also control the access to the data, and that's very popular when the data is personal and sensitive. Basically, an access committee, a human access committee, decide who gets to access it. They make sure that it's really a researcher that accesses it to do health research, and that it's not an insurance company or a government or the police. So that's why we call it controlled access. And you must complete a contract to access the data. And in that contract, you, for example, will guarantee that you're not going to try to find out the name of the person that the data comes from. And the most sophisticated means we hear about these days are called data federation. What it is that you actually never get your eyes on the personal data as a researcher. All you can do is explain to a database, a central database, here's what I'm looking for. Here's the type of data I'm looking for. For example, I have a cancer patient that has a mutation on this allele. Do you have another cancer patient in your data set that has the same mutation, etc.? And so you can query all the other database in the federation and you will get some answers, but never will the data be sent to you. So they will do any type of analysis you want on the premise and give you the response in a non-identifying manner. That's what we call a data federation. Moving on to the last issue I want to tackle today, that of genetic discrimination, which has been very dear to my heart in recent years. So what do we mean about genetic discrimination? Genetic discrimination is when you treat people differently and negatively, or you profile them unfairly because of their genetic characteristics. For example, and in a way that would affect their human right or their right to dignity. So for example, you tell them that they cannot buy insurance or that they cannot send their children to school because of their genetic characteristics, because they're more likely to develop certain disease. You refuse them a job because of genetic information. So I don't know how this is, how relevant this is for the African continent, and I'm really keen to hear you on this. We have very little data about this. This is data from my own research that you can see on the map here, and it shows the studies that have been done to this day on the incidence of genetic discrimination. The darker the color, the more studies have been done. So you can see that in the US, where most of the study have done, they've done over 17 different study on the incidence of genetic discrimination. When I did the map, they hadn't done a single study in Africa, which is a shame, really. And so it's really difficult, even in developed, in countries like the US, Canada, Europe, it's difficult to say how prevalent genetic discrimination is. We know that it happens in insurance and in the workplace. We know in Asia that it happens in terms of personal relationship like marriage, things like that. Genetic information becomes important. And we know that there are a lot of concerns. So when people refuse in North America to participate in genetic research, one of the first reasons they say why they don't want to participate is because they're afraid of genetic discrimination. So in response to this, a lot of countries have adopted laws to prevent genetic discrimination. Again, the darker color, the dark blue countries are countries that have adopted laws to prevent genetic discrimination. In yellow are the countries that have adopted ethics guidelines. So ethics guidelines are not as strong as law. They're not as mandatory. You cannot force people to follow them, although they sometimes are very persuasive. And other colors means there are some other strategies to try to prevent genetic discrimination in a country. So you can see that there's still a lot of gray area where nothing is being done about genetic discrimination so far. And the problem is also because genetic research is becoming international, national protection are sometimes insufficient to actually prevent genetic discrimination. So we have to look for international approach. And with that in mind, I created the first genetic discrimination observatory in the world in 2018. And you can see at the bottom map, these are all the countries that are represented in the genetic discrimination observatory. And I'm happy to say that we now have a representative in Uganda as well that joined us recently. So we're really starting to be around the world. And the idea is to have a center that's going to do research on how to prevent genetic discrimination across the world, evidence-based research, and propose policy models of how we can prevent genetic discrimination. Because again, national strategies might not be enough to counter this problem raised by genetic information. This is a slide I'll go over very quickly. It's simply to say and to acknowledge, but again, not sure how relevant this is for African groups, that, if we're going to ask people to share genetic information that they produce, we should reward them. Of course, it is relevant. I mean, if you are producing and sharing genetic information, you deserve to be acknowledged on publication at the very minimum. Sometime you should be able to participate in the research and be co-authors. So these are these little things. And sometimes we tend to forget about that. But if there is no motivation to share genetic information, people will not share it. So attribution and reward are extremely important if we want people to share genetic information for research. So in closing, a path forward, I think I've mentioned it, early preparedness. If you want to engage a large variety of population around the world, including population that have had bad experience with genetic research in the past, you need to prepare early to have planned policies in place, informed consent to address any issues that these population have prior to the research. So early engagement, early preparation, everything needs to be in place. And you address the concern of data misuse. You're transparent. It's so important to tell people, this is what I'm going to do with your genetic information. This is where the information will be stored. And this, and we will follow some of the most up-to-date standard of practice to protect the privacy and confidentiality of the information. Again, limit the number of repository to a minimum. Of course, you don't want to have hundreds of thousands of database all over the world, because for every database that you add, it's just more complicated because that's more people you need to go through to access the data. So you do need to keep the number of data repository to something that is manageable. Of course, you want to take care of local priorities, but you also need to make it functional to share the data and not too complicated. Funding agencies need to contribute financially to this. It costs money to build database and to protect genetic information. So if we're going to do it, there needs to be some financial help to do it. And eventually the goal is, as I mentioned earlier, this One Health genomic surveillance approach, where we'll be able in real time, and that will be so fantastic when it happens, to actually look at how a virus emerge in the flora, in the fauna, go to animals, to human, and vice versa. And we'll be able to track down this progression to react so much more quickly to emerging pathogen. And this is where the true value of genomic will be uncovered. On that note, thank you very much. And I really look forward to your questions.
Thank you, Prof. Thank you for that wonderful and very, very informative presentation. I appreciate that.